Hi, I'm Eunoia, an international ambassador for Eunoia Global Health. Eunoia is a platform for youth to educate others on diseases, raise awareness on health issues, and bridge the gap on disparities. It was created by high school student Elisa Tang to provide peers with a place to express their voices through science journalism, editorials, narratives, art, photography, videos, and podcasts. The name Eunoia has Greek origins, meaning beautiful thinking or well-minded. Today I will be talking about COVID-19 variants and their impact on vaccinations and how this can lead to antimicrobial resistance. First of all, we will discuss what causes a virus to change to a new variant. Inside a virus, there are molecules called nucleotides which form different combinations. One way to visualize this is a bike lock, with each wheel having 4 options, such as ACGU for RNA viruses or ACGT for DNA viruses. Now imagine that the lock has 30,000 wheels. This is the entire genome sequence of the virus. Each time that the virus spreads, it copies the sequence. When a virus replicates or makes copies of itself, the virus could change a little bit and evolve. This is normal, and all viruses mutate, including SARS-CoV-2, the virus that causes COVID-19. A virus with one or more mutations is referred to as a variant of the original virus. Usually, when this happens, these viral mutations do not affect how the virus works and have no impact on the virus's ability to cause infections and disease. Mutations arise from mismatches in nucleotide base pairings. These mutations depend on where they are located in the virus's genetic material. They may affect the virus's properties, including transmission, such as allowing the virus to spread more or less easily, or severity, such as the virus causing more or less severe disease. The base pairs in DNA are A with T. This means that the purine adenine always pairs with the pyrimidine thymine. The other base pair is C with G. This means that the pyrimidine cytosine always pairs with the purine guanine. Only with these combinations are there opportunities to establish hydrogen bonds between them. These hydrogen bonds are crucial to holding the DNA helix together so that they link together in the same sequence. It also helps enzymes and proteins recognize DNA so that they can carry out biological functions. The average number of hydrogen bonds for the matched base pairs AT and TA is approximately 2, and for pairs CG and GC it is approximately 3. If these base pairs are mismatched, they will contain a consistently lower number of hydrogen bonds than their matched counterparts. Since hydrogen bonding between opposing bases determines DNA stability, there will be a decreased stability in the presence of mismatches. Sometimes the variations formed are combinations that won't work. This might have happened because the base pairs were mismatched. Due to this, the mismatched base pairs would contain a consistently lower number of hydrogen bonds than their matched counterparts. Therefore, this would indicate decreased stability and make the virus variations a bit weaker, so they tend to die out. Other times, the variations can make the virus a bit stronger, such as better at transmitting or more resistant to the immune system. Therefore, these strains are more likely to thrive. This can especially happen when a virus is widely circulating in a population and causing many infections. This will mean that the likelihood of the virus mutating increases. This is because the virus has more opportunities to spread and hence replicate, so it has a higher chance of changing due to copying errors. However, sometimes the accumulation of genetic mutations in the virus can result in minor changes in proteins called antigens, which we will talk about later. This is called antigenic drift and can alter the way the body's immune system responds to the virus. We will now talk about the types of COVID-19 variants and how they are different. Currently, several variants of the virus are creating concern in the United States and other countries around the world. These variants include the Delta variant, Alpha variant, Gamma variant, and Beta variant. Firstly, we will talk about the Delta variant. This variant is the most common COVID-19 variant in the United States. Research has shown that it spreads much faster than all other variants. In fact, one person could spread the Delta variant to 3.5 or 4 other people in the same environment. This type of variant might also reduce the effectiveness of some of the antibodies generated by the COVID-19 vaccine and monoclonal antibody treatments. These are laboratory-made proteins that mimic the immune system's ability to fight off harmful pathogens, such as viruses. Another variant is the Alpha variant. This COVID-19 variant also appears to spread quite easily and has also been linked to an increased risk of hospitalization and death. Another variant is the Gamma variant. This variant reduces the effectiveness of some monoclonal antibody medications and the antibodies generated by a previous COVID-19 infection or the COVID-19 vaccine. The last variant we will talk about is the Beta variant. This variant may spread faster than other variants, but still not as easily as the Delta variant. It also reduces the effectiveness of some monoclonal antibody medications and the antibodies generated by a past COVID-19 infection or the COVID-19 vaccine. Now we will discuss how the COVID-19 vaccine works. A vaccine is a tiny weakened or inactive, non-dangerous fragment of an organism. This weakened version of the organism will not cause disease in the person receiving the vaccine. The vaccine also contains antigens of the virus. Antigens are the subpart of a pathogen that causes the formation of antibodies. The antibodies produced in response to a specific pathogen are an important part of our immune system. Each antibody is trained to recognize a specific antigen. We have thousands of different antibodies. When the human body is exposed to a new pathogen for the first time, the body takes time to respond and produce antibodies specific to its antigen. Once the antigen-specific antibodies have been produced, they work with the rest of the immune system to destroy the pathogen and stop the disease. This also creates antibody-producing memory cells that remain alive even after the pathogen is defeated by the antibodies. Therefore, if the body is exposed to the same pathogen again, the antibody response is much faster and more effective than the first time because the memory cells already contain the antibodies necessary to defeat the pathogen. Your immune system will respond immediately and protect against the disease since your body will already know how to defeat it. Newer vaccines contain blueprints for producing antigens rather than the antigen itself. This is enough so that our body can build a specific antibody. However, it will still prompt the immune system to respond as much as it would have on its first reaction to the pathogen, or more. This brings me to the next question. Is the COVID-19 vaccine more effective than the antibodies produced by a previous infection? An April study that has not been peer-reviewed has shown that 2 doses of either the Pfizer or Moderna vaccines offer 10 times higher levels of antibodies compared to those developed after natural infection. As well as that, another April paper showed that people who have been previously infected with the coronavirus experience significant boosts in their pre-existing antibodies after 2 doses of the Pfizer vaccine. Therefore, even if you have or haven't contracted COVID-19 before, it is still highly recommended to get vaccinated to have as much protection against the virus as possible. Some vaccines require multiple doses, either given weeks or months apart. This is needed to allow for the production of long-lived antibodies so that the body can fight the specific disease-causing organism by building up the memory of the pathogen. Therefore, when the body is exposed to the pathogen in the future, it can fight it off much more quickly. However, what impact do the new COVID-19 variants have on vaccinations? The good news is that although current COVID-19 vaccines are slightly less effective against the variants, they are still designed to work against the virus and its variants as well in most cases. This is because these vaccines elicit a broad immune response involving a range of antibodies and cells. Early research from the United Kingdom showed that after full vaccination, the Pfizer-BioNTech COVID-19 vaccine is 88% effective at preventing symptomatic COVID-19 virus caused by the Delta variant, is 96% effective at preventing severe disease with the COVID-19 virus caused by the Delta variant, and is also 93% effective at preventing symptomatic COVID-19 virus caused by the Alpha variant. If the COVID-19 vaccines prove to be less effective against one or more variants, researchers are working on ways to alter the composition of vaccines to cover new possible variations, such as by incorporating more than one strain when in development. Vaccine manufacturers are also creating booster shots to improve protection against COVID-19 variants, and other vaccine changes might be needed. Trials must also be designed and maintained to allow any changes in efficacy to be assessed. These must be sufficient of scale and diversity to facilitate a clear interpretation and understanding of results. Studies of the impact of vaccines as they are deployed are also necessary to assess their impacts. Now, we will discuss what has been done to monitor and understand the impact of virus variants on the efficacy of the COVID-19 vaccine. First of all, the World Health Organization has been tracking mutations and variants since the start of the COVID-19 outbreak. This includes a dedicated virus evolution working group that aims to detect new changes quickly and assess their possible impact. Additionally, WHO has recommended that countries increase the sequencing of COVID-19 where possible and share data to help one another monitor and respond to the pandemic. WHO has also established a SARS-CoV-2 risk monitoring and evaluation framework to identify, monitor, and assess variants of the virus, involving components such as surveillance, research on variants of concern, evaluation of the impact of diagnostics, therapeutics, and vaccines. This framework will guide manufacturers and countries on changes that might need to be made to the COVID-19 vaccine. Research groups have also carried out genome sequencing of the COVID-19 virus and shared these sequences on public databases and global health initiatives, such as GISAID. This global collaboration will allow scientists to track how the virus is changing over time, how the variants are affecting the virus's behavior, and the impact of this on vaccines' efficacy. This is an area where evidence remains preliminary and is developing quickly. Now, we can discuss ways to prevent future variants of SARS-CoV-2. Current measures continue to work against new variants by reducing the amount of viral transmission and therefore also decreasing the potential opportunities for the virus to spread and hence mutate. This includes frequent hand washing, wearing a mask, physical distancing, avoiding crowded places or closed settings, refraining from smoking or other activities that weaken the lungs, and not touching your face. Additionally, scaling up vaccine manufacturing and rolling out vaccines as quickly and widely as possible is also a critical way of protecting people before they are exposed to the virus and decrease the risk of new variants. Ensuring equitable access to COVID-19 vaccines is also essential to address and conquer the pandemic. However, people with underlying health conditions such as HIV or cancer and others who have severe allergies to some vaccine components may not be able to get certain vaccines. But it is still important to remember that these vulnerable groups can be protected if they live in and amongst others who are vaccinated. When a lot of people in a community are vaccinated, the pathogen has a hard time circulating since most people it encounters are already immune. Therefore, virus circulation will decrease and lead to fewer mutations. The more people that are vaccinated, the less likely people who are unable to be protected by vaccines are at risk of even being exposed to the harmful pathogens. This is called herd immunity. Thank you for watching. You can contact us through our email, eunoiaglobalhealth@gmail.com, or Instagram @eunoiaglobalhealth. Check out our website www.eunoiaglobalhealth.com for more information.